Hi everyone, welcome back. Today I'm joined by Dan Liljenquist, Senior Vice President, Chief Strategy Officer here at Intermountain Healthcare to talk about Project Protect. This is a community project in collaboration with Intermountain, University of Utah Health, Latter-day Saints, and other Utah companies here in Utah. We're going to talk a little bit about the importance of this project, how you can get involved, and why this project even started to begin with. Dan, thank you so much for joining us.
Amanda, good to be with you. Thank you.
Yeah, so I want you to tell me a little bit about how this project started, from the date it started to when the actual project kicked off for the community to get involved, and what was the purpose and reasoning behind this project?
Sure. So Amanda, as COVID-19 has exploded worldwide, the demand for personal protective equipment has been well publicized. And in fact, all these traditional supply chains is, for face masks and face shields and gowns, everybody is rushed to get those because they're needed when you're in close contact with a COVID-19 patient. And, we started sensing in early March that there were going to be challenges with our supply chain. And as in an ELT meeting on March 18th, Dr. Harrison said, Dan, will you look at what our options are to produce PPE locally? So it really started the afternoon of March 18th. And then, it's been a whirlwind since then. We realized that there were really three key elements of PPE that we were struggling to source. First was face shields. I mean, these are things we just typically don't use to cover your face, protect you against kind of droplets as patients are coughing. And we hadn't used those. The second was face masks. We don't typically mask our caregivers throughout a hospital, but as we all know now, masks are critically important. And the third were isolation gowns. Again, these are not things we routinely use throughout the system on a day in and day out basis. So that's where we started. And frankly, the toughest one to figure out was the face masks. The worldwide demand had exploded, and we jumped right in to design our own face mask, to come up with a pattern, to figure out how to produce, patterns for people to sew, and then a real big adventure in trying to figure out how to source 50,000 kilograms of polypropylene mesh from China at the same time everybody else was trying to get material out of China. It was quite the whirlwind, but within a month we had launched a program. We're now in week 4 right now, and week 5 will be next week, and so far by this Saturday we'll have produced 5 million masks sewn by about 40,000 unique volunteers. It's been pretty remarkable.
That's incredible that we've reached that goal. I know the initial goal was 5 million masks in 5 weeks. Can you talk a little bit, too, about the collaboration with the University of Utah Health and Latter-day Saint Charities and how that came to be and how they were involved in the whole process?
On the 19th, so the day after I received this assignment, I received a forwarded email from one of our physicians at Primary Children's Hospital saying, hey, what can we do locally? He had also simultaneously reached out to the University of Utah, and so we got connected with the university on the 19th. They had reached out to Latter-day Saint Charities and said, hey, can you help? Originally, I think the ask was, hey, can we get 10,000 masks made? And I heard that and I thought, 10,000, we need 5 million. And so on Saturday the 21st, I got on the phone with Sharon Eubank, who's the president of Latter-day Saint Charities, and said, Sharon, if we can get the material and come up with a pattern, can you get us volunteers to make 5 million masks? And she didn't hesitate. She said, absolutely, we'll do it. So with that assurance, we went and found the material and got it going. And we, on Sunday the 22nd, we got together with our first phone call as the Intermountain University and Latter-day Saint Charities set up 6 different work streams to kind of make this happen, and we've been meeting almost every day since. And it's been really fun. It's been fast moving, but everybody's just come with their sleeves rolled up to fix this problem. It's been really fun.
You talked a little bit about the instructional guides too. Who was involved in creating the actual guidelines for the community members to help out, and what was the process in vetting the instructions so that way they actually worked?
Well, it was unbelievable collaboration, particularly with the team at Latter-day Saint Charities. They've been putting together instructional videos and materials for a whole bunch of different projects around the world. As people, they're trying to teach the principles of self-reliance. So they have a wonderful team. And they had been working on some materials around cloth face masks, and were able to just take that infrastructure they had already built, and we just started filling it with information about these medical grade masks. While that was going on and that was being developed, not only the pattern, but actually how to sew the masks, we worked with a local company called Jack Suits, and their CEO is a tailor, and he kind of took a pattern, created the pattern, and then worked with Latter-day Saint Charities to build the instructional videos and content. While at the same time, we were testing with our Intermountain Industrial Hygiene team the polypropylene mesh, taking it to our PPE task force and testing it, whether or not it would work. And all that happened at the same time. So within 3 or 4 days, we had identified the mask, we had identified the material we wanted to use, and we had the instructional pieces ready to go. And by the next week, taking surgical wrap, which we use in surgeries, and those have been shut down, so we had extra, we were able to punch out some mask kits and pilot the project a week later. It was really fast. So
with the masks themselves, they're medical grade masks, which means they're used in our healthcare settings. Can you explain a little bit about why these masks are so important for someone who's coming in contact with a potential COVID-19 patient?
So obviously the highest level mask we have is an N95 mask, and everybody knows those masks, where the filtration is very, very high. These are a step below those masks. They're made out of polypropylene, which is incredibly water repellent. And the difference between a polypropylene mask and a cloth mask gets saturated really quickly with liquid, with droplets. And these polypropylene masks are really about droplet protection, and they just function better. So we focus on those masks for those in healthcare settings because they do repel water much better.
You also were talking a little bit about the sanitation factor of them. So when a community member gets the mask, makes the mask, what happens once they turn them in? Are they sanitized by a team before they're given out to the community, or what's the process with that?
So what we do is when we get them back in at Intermountain Healthcare, we have a team that reviews each mask and visually inspects each mask, and then we autoclave them. In our hospitals, and in fact, most of them are being autoclaved at Altaview Hospital, which is a sterilization process that we use to sterilize surgical instruments. And at that point, they're packaged and then put into our supply chain and can be ordered through the supply chain.
And do you know how many masks we typically go through outside of COVID-19? How many masks were we going through to begin with? And then now, how many masks are we going through?
I think it's, and I'm not the best source on this, but I think it's been about a 15x increase in the use of these masks because we're masking everybody. And I think our burn rate, last month we burned through about 1 million masks in a month, which was way higher than we had ever expected. And that was without the surge coming. And that was what caused our supply chain folks to say, hey, we've got to figure out something quickly. Project Protect will provide Intermountain about 3.75 million masks. The U will get another 1.25 million, and we did that based on the number of licensed beds each system has. And this should be, we think, enough to see us through the expected surge. The good news is that we are also, at the same time, trying to source additional masks from the international supply chain. And one of the reasons why we felt like we could donate masks to the community, Project Protect, by the way, on Monday, donated 500,000 masks to the broader community need for a couple of reasons. One, we did have a mask order come in at Intermountain, which bought us a couple of weeks, and then we knew there were immediate needs in the community. And two, the volunteer response has been so great, and we actually have a little bit more material than we thought we would have at this stage, that we felt like if we extended the project 2 additional weeks in June, we could provide immediate relief now to other healthcare workers, not at Intermountain in the university. We could meet their needs. So that's what we've done.
So we saw that you actually have made some masks. You've been involved in the process itself. What was it like making a mask and not only creating this entire process, but then actually getting your hands dirty and making the mask themselves? How long did it take you? Was it easy, hard? What was the process like?
Well, by the 12th time I tried it, I got it down. I'm not a sewer, but for an experienced sewer, what I'm hearing from volunteers, for the first 20 masks, it probably takes 15 minutes a mask. I was talking to Gail Miller, who's sewn about 400 masks herself. She's got it down to 3 minutes. I will never be that fast. I think the couple of masks I was able to get through, I think I did 5 masks maybe in an hour and a half. And I had a lot of help with others who were pinning the masks. We kind of had a production line, but I'm much better at folding and pinning the mask than I am using a sewing machine. So, but I think on average when people settle into it, it's between 5 and 10 minutes a mask.
So how does the process work to volunteer? How do we sign up? And also, how do I get the kit myself? And when do I bring it back to where I picked it up from?
So the way we're doing it is we are go to projectprotect.health, and that will link you to a website called Just Serve, and you register on Just Serve, which is a volunteer website for a variety of projects, but this being a specific project. And then on that, you'll see options to pick up masks. And we have 5 different locations right along the Wasatch Front. And then for the first time this week, expanded down to St. George at Dixie Regional Hospital. There's a location down there. But you'll register to pick up a mask kit. They come in 100 mask kits. And you'll pick them up on Tuesday, whether it's, at the Deseret Industry locations along the Wasatch Front. So there's one in Murray and Riverton, one in Layton, one in Harrisville up in Weber County, and one in American Fork. And then at Dixie Regional Hospital in St. George. And you'll pick them up on Tuesday. And then next week, actually, given that it's Memorial Day weekend, we're actually not going to collect them until the following weekend, so that we're not asking people to return them on Memorial Day weekend. But ordinarily, you pick them on a Tuesday, return them on a Saturday. Next week, you'll pick them up on a Tuesday and return it the following Saturday. So you have about 2 weeks. And then when we do this again in June, it'll probably be mid-June for a couple of weeks.
So if you wanted to do more than one kit, especially in that 2-week period for Memorial Day, is that an option? Are you allowed to register for more than one kit?
So we've not opened up registration for more than one kit. However, if you have more than one person in your household who wants to help, they can register each person multiple times and then come and pick up the kit. So yeah, we do have some super coordinators who've picked up 100 kits, and they're being responsible to distribute them more broadly. But you can register, or a family member could register and then go pick them up. And that's kind of what our family has done. We've had different people register and pick up a handful of kits, and then we kind of work on them together.
That is the nice thing, is that if there's someone in your family who maybe doesn't have a computer or access to registering, you could register for them and then bring all the confirmation emails with
That's
you
correct.
to the DI or Dixie Regional and pick up the kits, which is great. You also mentioned those super users. There's definitely a huge community behind this. We actually have a Facebook group with all of our sewers in it, and the camaraderie is amazing. They're constantly asking for advice or looking for extra materials if they need them, and it's been really great to see this community come together. So Dan, what does this project really mean to you and to our community overall with everything that's happening?
Look, I already knew we lived in the most generous community in the world, and objectively so. This community gives more time and volunteer hours than almost any community. I think, frankly, objectively so than anywhere else in the world. And so, making the ask of Sharon Eubank to say, hey, can you help make this happen? I was confident they could, but it's still awesome. It's still incredible to see people who are making their offering and saying, look, I'm willing to do this. And it's been tens of thousands of hours have gone into this. The stuff that touches me the most is, the stories of people saying, the stitching on the front that says, thank you very much, to a handful of masks that came back, or, the hearts that are sewn on the edges. There are a lot of people who care, and they care deeply about the safety of our caregiver and the caregivers in our community. One woman told us that, she prays over every mask and prays for the caregiver that will wear that mask and for their families. And I think it's brought people together in a unique way at a unique time. And I'm just profoundly grateful for it. I think it'll make a big difference. Certainly will make a big difference for Intermountain Healthcare and the University of Utah Health. But now it will make a difference for more broadly with other healthcare workers in our community, in nursing homes, in dentists' offices, in clinics, and other places where they might be at risk of contracting COVID-19. So it's fun to see. It's It's the biggest volunteer effort since the 2002 Olympics. And it's nice to see it coming around something that matters, you know? Yeah. So it's been fun to be a part of and to see it kind of come from an idea to broad-based community involvement.
Well, Dan, thank you so much for joining us today. We really appreciate it. And a couple of those resources that Dan mentioned, you can go to projectprotect.health. There's a volunteer and get kit button in the upper right-hand corner. You can click on that. It takes you to justserve.org where you can sign up to volunteer at a couple different locations. On our projectprotect.health site, there's also 2 different guides. There's one for the clinical masks, and there's also a guide for face coverings if you just want to donate to the community. We have a couple different locations accepting face cloth masks as well for our patients who are coming in without a mask to the hospital. We also still have our COVID-19 hotline available. You can call it at 844-442-5224. That phone number is available if you have symptoms and would like to get screened and tested for COVID-19. We also have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Thanks, everyone. We'll see you next time.